What is the role of urethral sensation in urinary urgency? Imagine feeling a sudden, intense urge to go to the bathroom that you just can't ignore. That sensation of urgency is a complex process involving more than just the bladder. It also depends on the urethra, the tube that carries urine out of the body. The urethra has special nerve endings that detect pressure and irritation. These nerve signals work together with the bladder to help your brain understand when you need to urinate. The bladder itself has stretch receptors that sense when it is filling up with urine. These receptors send signals through nerves called delta fibers, which tell your brain that your bladder is getting full. Sometimes, there are other nerve fibers called C fibers that respond to pain or irritation, and they can make the sensation of urgency feel even stronger. When the bladder is healthy, these signals are balanced, and you only feel the need to go when your bladder is truly full. However, the urethra also plays a key role. It has sensory receptors that detect changes in pressure or irritation, especially in areas like the posterior urethra and the trigone, which is a part of the bladder where the urethra connects. If these receptors become overly sensitive because of inflammation, infection, or injury, they can send exaggerated signals to the brain. This can make you feel urgent even if your bladder isn't full, leading to what we call urinary urgency. In some cases, damage or dysfunction of the urethral sphincter, the muscle that helps control urine flow, can worsen this sensation. If the sphincter doesn't work properly, it can allow abnormal signals to trigger bladder contractions prematurely. This is common in conditions like overactive bladder, where the bladder contracts involuntarily, causing urgency and sometimes leakage. Research shows that the interaction between bladder and urethral sensory signals is vital for normal urinary control. When this system is disrupted, due to inflammation, nerve damage, or tumors, it can cause abnormal sensations and urgency. For example, in bladder cancer, tumors near the urethra or bladder trigone can irritate these sensory pathways, making urgency worse. From a bladder health perspective, keeping the urethral sensory system functioning properly is important for maintaining continence and comfortable bladder storage. If inflammation or disease affects the urethra, it can disturb sensory signaling and lead to persistent urgency. Understanding these mechanisms helps healthcare providers evaluate and treat urinary symptoms effectively. In summary, urethral sensation works alongside bladder signals to regulate the urge to urinate. When the urethra becomes overly sensitive or its function is impaired, it can contribute to the feeling of urgency. Protecting urethral health and addressing underlying issues are key steps in managing urinary urgency and improving quality of life. Always consult a healthcare professional for personalized advice if you experience persistent urinary symptoms.